Leg treatment. Okay, very good. Now we're going to look at leg treatment. It's the same thing as we did on the arms. So we will always start from the outside and we unglue the skin in an inward movement, so towards the inner thigh. The only thing you have to be careful of is that as you approach the groin and the inner thigh, well, that area is rich in lymph nodes, so you have to measure out your strength. You see, I don't go beyond this part. I don't go above that because those are parts that should be worked in lymphatic drainage. So, as you can see, it's very simple. This technique makes thighs slimmer, so also for aesthetical purposes. It's perfect for people who have cellulitis. It alleviates and it improves cellulitis in every case. If you work on the gallbladder metamere and the corresponding dermalgia, you see that I'm gluing the skin here. Now there are areas where that can be more painful, so you try to alleviate, you try to not pressure too much, not put too much pressure, and then you continue. So I do it through all over the thigh. The results are incredible. When a person comes to me for a treatment just to slim the thighs, well, I immediately work with this technique. Even if they're painful or even if they have capillary veins, the results are amazing. Also aesthetically. Now you probably, as opposed to what you've been probably told, that when you see veins you should never work on them. Well, I've always done that and I've always had excellent results. Now I move myself over with a video camera. I'm on the outside of the thigh and I start from bottom to top. Start again. You can work on this on the legs as long as you want until you achieve your aim, both to alleviate pain, which could be here, exactly here. Here we have the hip joint, so anyone who has pain in the hip, you can use this technique. After we have unglued the entire thigh, we have to work on the knee. This will improve all types of knee pain. Well, not all of them, but obviously if the knee is broken, we can't do miracles, but we will certainly improve also that situation. As you can see, first I identified the kneecap and then I will perform the technique all around it. Now, the day after this treatment, the knee will tend to swell with liquid. Well, just tell them that, this is normal because the lymph has been, the knee has filled with lymph, which will, but anyway, this will only last a couple of days. So actually 1 day, 24 hours. So the person will be reassured if you tell them. And in the meanwhile, you have improved the knee. Now, you have to be very accurate here. When you're at knee height, the skin is always thicker. So you have to, use all the patience you have and unglue the skin. You can see you start from the outside, even if the skin tends to slip through your fingers, and you unglue the skin all around the knee. In fact, it's not so important which direction you work in, whether from the outside to the inside or vice versa. The important thing is that you unglue the skin, that you form this roll of skin, and you do it all around the knee. Now, you see how I changed technique here, but the intent is to unglue the skin. And then we can work on the calf. So, always in the inner calf, times in this point, in this body part, you can't start from the outside because we have the fibula. So here I'm working on the calf, and I work with patience in all the various nerve fascias. You see, I unglue the skin all the way down to the ankle. Now I had my customer turn around with her belly facing down, so it's easier to work. So I will always start from the outside in an inward movement. I pinch the skin, and then I unglue the skin. This slims the calves. This is good for people who suffer from cramps, for people who have veins, for pain in the knee. The area I just indicated, that is the back of the knee, at times may swell. It's also rich with lymph nodes, but as opposed to the groin, you can work on it, especially when it's painful. To relieve pain in that area can be quite easy using this technique. Think that in the beginning, when this area is compressed, it may also give rise to cysts. If you alleviate this area, these cysts will go away. So now you see I'm working at the base of the calf and slowly move over to the tendon. You see how this is becoming more difficult and then losing my grip. Try to do your best in this case, but it's important to unglue the skin in these parts, especially if the person is in pain. So now that you've learned to do it, even if the person is in pain, do it. Do this ungluing work, and you'll see the excellent results that you'll get from this. Now I'm working on the thigh. And even here, it's not easy because these are very thick tissues. So the skin will tend to slip through your fingers, but with patience, you alleviate the whole thigh. Up, all the way up to the hip joint, which is good to work on to alleviate pain. The more painful is the person in this area, the more you work on it. It's almost as if you want it to enter the joint. This will improve the nerve supply and the pain will be relieved. You could also, while you're at it, unglue the skin in the genital system zone. So as you remember, if you remember everything I've explained to you before, this improves both physical, both in men and women, the physical, it has physical results, in other words. And it also has a positive effect on the emotions. The person will feel in a better mood because it is like an antidepressant. And so work on the gluteus for all people who are depressed, because it has a hormonal reaction, and as a result they will feel much better.